in order to allow physicians to take care of Medicare beneficiaries the best way possible and to avoid them getting sick during this COVID-19 public health emergency, Medicare has made it a lot easier for us physicians to take care of these patients. In this video, I'm going to go over a few things which Medicare has changed to make it a lot easier for us to code and bill for the care of Medicare beneficiaries. Hello, my name is John Lin. I'm a urologist in Gilbert, Arizona. Also, sometimes I speak publicly in presentations and seminars about coding, billing, and practice management to my urology colleagues. It appears that a lot of my physician friends and colleagues have no idea of the changes that have happened recently when it comes to evaluation and management, coding and billing for the care of the Medicare beneficiary. Specifically, in the past, our billing and coding for evaluation and management used to be based on a couple of different things. One, you are billing based on component, and there were essentially three different components when you are billing for an E&M visit, namely history, physical examination, and medical decision making. The other way that you can bill for an E&M visit will be based on time. In the old days, for a new patient, you needed to document history, physical examination, or if it's an established patient, you need two of the three to bill for a visit. In the past, if you're billing based on time, 50% of the, or greater than 50% of the time spent face-to-face with the patient would have to be involving the coordination of care or counseling for that particular patient during that particular day. And it's only that face-to-face time that you can count. Well, that's in the past. During the COVID-19 emergency, the government really wants us to take care of these patients the best way that we can without compromising their safety. Meaning the government has relaxed the rules when it comes to E&M billing so that we can take care of these patients using telemedicine. As such, CMS 1744 Interim Final Rule, you can look that up yourself if you wish, has greatly relaxed our ability to take care of our Medicare beneficiaries using similar E&M rules, except greatly simplified, greatly modified, much easier for us to take care of these patients and bill an E&M visit as if we're seeing them in real life. All right, now, for a new patient or an established patient, you no longer need to document history or physical examination to drive an E&M visit. Specifically, the only thing that you need to drive an E&M visit will be medical decision making when it comes to billing. All right, so for Medicare, again, for Medicare, you do not need a history or physical examination documentation to code for an E&M level. Instead, the only thing that you need is medical decision making. Now, this is huge, right? In the past, we are just counting bullets and trying to capture documentation just to jump through the hoops. Now, the only thing that you need to document is what's medically relevant, right? The way it should be, the way it should have been in the past. But unfortunately, government mandates require that we jump through a whole bunch of useless hoops so that we can bill a certain level. No longer during this COVID-19 public health emergency. To drive an E&M level, the only thing you need during the current COVID-19 public health emergency is medical decision making. Now, those of you who are savvy, you understand that medical decision making comprises of three different elements. I know, it's crazy. These three elements are number of problems, the amount of data, and also risk. Out of the three elements in medical decision making, you only need two of the three to drive your final E&M level. So during the current COVID-19 public health emergency, you only need medical decision making to drive an E&M level if you decide to bill by component. So that is huge. Now, what if you want to bill by time? Remember, in the past, you have to bill you only billed face-to-face time, and that's the only thing you could bill. In addition, over 50% of that face-to-face time has to be involved in the counseling and coordination of care for that patient. During the COVID-19 public health emergency, that is no longer the case. Face-to-face will be via telemedicine, obviously, but not only do you count that face-to-face time, but you also count the time that you use to prepare the chart, to review the records for that patient. You include all that time that you use to take care of that patient within the 24-hour period. You count all that time, add it all together, and you come up with a level commensurate with the amount of time that you spent in total for that patient. And that 50% involved in counseling and coordination of care, that is no longer applicable during the COVID-19 public health emergency. Now, that said, with the evaluation and management based on medical decision making and also the billing based on time, the way the rules are set up right now, how long it's going to last, who knows, right? Until the public health emergency is over. But you should know that for Medicare patients, these are the current rules, and you should definitely take advantage of it. Make sure you are billing accurately so that you can take care of these patients the best way that you can. And in the meantime, you want to bill accurately and correctly. So lastly, I will leave you this. Medicare expects us to bill these E&M visits that you conduct using telemedicine by utilizing Place of Service 11, Place of Service 11, and Modifier 95 if you use synchronous audio and video, which is what most of us do anyway when it comes to doing evaluation and management. So Place of Service 11, Modifier 95 for your Medicare E&M visits that you conduct using telemedicine during the COVID-19 public health emergency. If you found this information to be helpful, give me a thumbs up, like, subscribe, share the information, or ask any questions you have in the comments below. I will leave in the video description the direct link to CMS 1744 Interim Final Rule with comment period. It's a lovely 221-page document that you can use to put yourself to sleep. In the meantime, take care and be well. Bye-bye.